This is a test. I'm testing. I don't know. Is this gonna work? Okay, cool. I'm hoping this works. I don't know if you can see this. I don't even know if you can see me. You can see the bear, I know that's for sure. Okay. This is very awkward. I don't know how I'm gonna do this. This is really strange, just staring at a camera and talking into it. This is my presentation on, what's the drug? I forget. Hold on. I know this is bad. Already marked me off points for not knowing all my information. Celecoxib. I hope I'm saying that correctly. I guess I shall start this as if I'm going to present it to my 17-year-old male patient. You did not give me a name or a date of birth, so I'm going to use my imagination. Bubbles, the bear. The imagination we're going to use during this video is that I'm wearing a nurse outfit, because my nursing outfit is in the laundry, and I don't feel like going to fetch it. It's going to sit there for a little bit and become stinky, so I have to run it through the washer again, because I'm too lazy to go get it. This is probably too much information for this video. Anyway, I'm just trying to get past the anxiety and like the awkwardness, which I don't think it's going to happen. I don't know. I'm going to hold this up. I don't know if you can see this. I don't know where I don't know how the camera sees me. I don't know the parameter. Like, I know the chair was sort of in it, and I know that like the corner of the couch might have been. I don't remember, honestly. Roleplay walks into room. Hello. Can you give me your name and date of birth? Thank you. You've been prescribed Celecoxib. I have a brochure here for you that is totally printed out and looks beautiful and stylish and deserves a lot of points because I took a lot of time on this and it took a whole day. So I should get some extra points. I'm just saying, whatever you want to do. So I shall present this information to you in a way that you would understand. That is the point of this brochure, is to use layman's terms, not to degrade you, but just to let you know that you do not know the technical terms that I know. This drug is clearly an anti-inflammatory, and I'm sure that you need that because you recently had undisclosed surgery that I don't want to say. I hope you find this as funny as I do. Going to the next page, we have how does it work? If you care, because I uploaded the slideshow, if you want to follow along to see what I'm talking about and like what I'm reading, please feel free. It'll be very nice for you. You'll understand a little more in the context of where I'm coming from. Bubbles. How does it work? Well, I'm glad you... Bubble. What's that? You want to know how it works? Well, let me tell you. Hold on, my cat wants out. He's very upset that I kicked the door open. How does it work? Well, it blocks an enzyme called... I'm going to use Google. Google's going to say... It's going to say it for me.
Cyclooxygenase.
Or better known as COX. COX allows the body to make prostaglandins. I don't know why I'm looking at the camera when I need to be looking at you as if I'm presenting. Prostaglandins are hormones like This is going very smoothly. I hope the editing does this video justice. Prostaglandins are hormone-like substances that induce inflammation, which can lead to that pain, itching, and heat feeling you get when you cut yourself. That sounded very aggressive. When you have an injury, this kind of medication is known as an NSAID, which is a very interesting name. That's an acronym, right? NSAID is an acronym. I hope I'm saying that right. Non-steroidal anti-inflammatory drug. That's beautiful. You should be holding this, but I have to look at this because I don't even know what I wrote down. Now, in the situation that there's a problem and you start having some side effects, Some of those side effects could be myocardial infarction. I like saying that word, infarction. It's a good word. Stroke, GI effects, including bleeding, hypertension, edema, long-term renal and hepatic impairment. If I could read really fast, I'd do it like those old infomercials where it says all the side effects like really fast, like
myocardial infarction, stroke, GI effects, hypertension, edema, long-term renal hepatic impairment.
If you have any hypersensitivity to the ingredients within this drug, stop immediately. If you have hypersensitivity to sulfonamides, you know, you'd think you'd have a professional telling you this information, but you really don't even know like what's happening because you don't have a brain. If you have history with coronary artery disease, you definitely don't want this. If you have asthma, probably not a good idea to take this because I don't know why you can't take this with asthma. I really don't. You don't want to take it with urticaria. You also don't want to take it with the aspirin triad. Like I said before, you don't want to take it with hepatic impairment or any GI bleeding. If you're having GI bleeding, you shouldn't even be sitting here. We should have you, like, somebody should be looking at that because that's not normal. That's a problem. If you have rectal bleeding, please see a doctor. Also, if you're pregnant, I said that very aggressively. If you're pregnant, don't take this. Here's some implications to think about when you're taking this drug, Mr. Bubbles. You may have cross sensitivity to other sulfonamides. I really wish I could read, which is a broad spectrum antibiotic. Just in case, because I know the words, if you're not familiar with them, you don't know what they really mean. But I think everybody kind of knows what an aspirin is. What's an aspirin? You don't want to take it with other NSAIDs because doubling up on NSAIDs, doubling up on anything is a problem. Because if you already have an NSAID and you put more NSAID, you're going to double that reaction. If you begin to have a skin rash, you may want to stop it. That's not normal. What's that? You don't know how to take pills because you're afraid you're going to choke on them? Don't worry. They're capsules, and you can open them and sprinkle them on a small portion of food, just like applesauce or something. If you don't like applesauce, then pudding. Everybody loves pudding. I know I do. Too much. But you will need to follow it with water. I'm not sure why. I'm assuming it's from the powder to get it into the system because you don't want it too little. So water. And that has to be immediate. You have to do that like as soon as you take the food with the powder. If you just do it with a pill, I mean, usually you want to drink it with black box warning. Black box warning. It's very intimidating. It's very large and scary. The NSAIDs increase risk of serious or potential fatal cardiovascular thrombotic events. So, if you don't know what that means, neither do I. I'm kidding. Of course I know what that means. I'm just kind of leveling with the patient so they don't feel so below me. In fact, if I was a real nurse, I'd get down on my knees so that way I was at the same level as them. That was very inappropriate to say for this school project. If you are experiencing GI bleeds, ulcerations, or perforation, no, I take that back. NSAIDs cause those things. So this drug is very scary. Why are you so quiet? What are you thinking? I believe I told everything that you need to know, Bubbles. Can you restate everything that I told you in your own terms so that way I know that you know what you know? Thank you, Mr. Bubbles. You clearly know what you're talking about. In fact, I almost think that you're more of a professional at this than I am. What are your secrets? What are you not telling me? Some of the things you saw on my pamphlet, my brochure, aren't my images. I think you could assume the box of the medicine and the pills clearly was not mine. The emergency symbol, that's not mine. The chemical, like designs of the chemicals, not mine. Probably some other stuff that I'm not thinking of right off the top of my head right now, but most of the designing of the brochure is mine, like the fancy background and everything, because I'm an artist and a lousy one at that. All right, thank you. My information came from Dr. Joris. This was so bad.